Canada's children and youth are, by international standards, quite healthy. In 2005, Canada had the 5th highest ranking for children's health status out of 125 countries. So why has the Health Council of Canada released a report focused on the particular needs of children and youth?
While we can revel in the fact that most of our children do well, we have to be profoundly embarrassed as a country that we have populations of children that in fact do not do well. This report highlights in flashing lights that the social and economic context for children is powerfully important in their long-term health. Even those children who are born healthy and well in advantaged family situations and social situations are presenting us with real concerns related to issues like obesity and all the consequences of that in terms of long-term health.
Evidence tells us that the sooner we act, the better the outcomes. And we know that there are things that we can do to help improve the health and quality of Canada's children and youth. The Health Council of Canada's report features some of the programs and initiatives across the country that are working well, and it highlights the key ingredients to their success. One unique program, Healthy Child Manitoba, exemplifies many of the success factors. In March of 2000, the Premier of Manitoba created Healthy Child Manitoba, a multi-ministerial commitment to healthy child development supported by a secretariat and a cabinet committee.
Early child development is one of the most important determinants of health. And by that we mean that not only physical development early on in life, but social and emotional development and language and cognitive development all have lifelong impacts on future health to deal with the way in which social circumstances influence health. The health system has to work in partnership with other agencies within society.
And that's just what they did in Manitoba. 8 ministers from health to education, social services to justice, all working together in partnership. A first in Canada, their approach combines political vision and community leadership focused on improving the overall health status of their children.
We want children to have healthy bodies, but we want them to have healthy minds and healthy opportunities and healthy futures. We are 8 ministers coming together on a regular basis to talk about the very issues that mean the most to our children. That not only means that they're at the forefront of every single cabinet meeting that we have, but most importantly, our Premier recently set a mandate that every department set aside a certain portion of their budget specifically for early childhood needs.
Healthy Child Manitoba knew its most important partnership would be with communities, and so they created 26 province-wide parent-child coalitions whose role is to drive, focus, and implement programs. Each year at the Kids and Communities Conference, all the groups come together, meet with other stakeholders, exchange ideas, and attend seminars on best practices so they can design evidence-based programs that suit the needs of their communities.
Healthy Child has given us the opportunity to come together as a community to assist in raising that child, and that's what's so exciting about it.
For the community coalitions, the conference gives them an opportunity to talk and meet directly with the 8 Healthy Child Cabinet Committee members. For the ministers, the sessions are an opportunity to gather information on local issues. This helps ensure future government policy addresses local concerns.
We really take our lead from what's happening in the field. It starts at the grassroots, it happens at the cabinet table, and it goes right back to the grassroots. When we are talking to those families and we can hear what their needs are, we can start to make our investments in a more specific way.
While investment is critical, Healthy Child programs are fueled by local activism. Volunteers, educators, public health providers, and parents design and deliver them to children. Here in River East Transcona, volunteers are at the heart of the success of programs like Alphabet Soup, which teaches preschoolers healthy eating while building literacy and numeracy skills designed to help them when they enter kindergarten. The province also has developed programs like Families First that match parents who need support, like Sherry Wasson's, with specially trained home visitors and, when needed, public health nurses.
When I had Joey, Patty came by to check up on me and stuff, because it was about 2 or 3 days after I got home from the hospital. And then she was asking me how I felt about being a new mom and stuff, and basically if I thought I needed help, and I told her yes.
Sherry's been part of Families First ever since, and they continue to support Joey's development as he heads off to school.
I have seen tremendous progress with Joey and Sherry. Sherry has grown hugely as a person. She's much more independent and she's much more confident. Joey has overcome some language concerns that we had. He has done fantastic with that. So there's all kinds of positives that have come out of the program.
Basically, Pauline's been my rock through this whole thing. Because of Pauline and Patty, I became a stronger person.
So we know that we can get a very, very large return for an early investment. There's a great deal at stake in terms of getting the early years right. If we were to do the best for our kids, what we would be doing is thinking about what are we doing to support families, what are we doing to create neighborhoods that work for kids, and what are we doing to break down barriers of access to programs and services that support development. The approach that they're taking in Manitoba has the most promise of any across the country because they've attended to all of these pieces together.
The one thing that I would want people to really accept and understand is that negative health consequences for children are not inevitable. We can make choices for Canadian children that make a difference.
And to that end, the Health Council of Canada's report calls on all levels of government to invest upstream to ensure a healthy start, build a healthier economic foundation for all Canadians, and to adapt and adopt what is working. Because we all can make a difference for children and youth that will last them the rest of their lives. Copies of Their Future Is Now are available at www.healthcouncilcanada.ca.